Hello everyone, myself Dr. Pradeep Kumar MR, working as Assistant Professor in the Department of Pharmaceutical Chemistry at KLE College of Pharmacy, Hubli. In this session, I will be discussing on the topic Anti-Fungal Agents. Introduction. Compounds are the agents used in the treatment of fungal infection are called antifungal agents. They are also referred as antimycotic agents, as fungal infections are also known as mycosis. Fungal infection may be a superficial infection or systemic infection. This image represents a superficial infection. This image represents systemic infection. Coming to the morphology of fungi. This image shows the constituents of cell membrane and cell wall of fungi. It's made up of manoproteins, beta-1,6-glucan, also beta-1,3-glucan, then chitin, followed by phospholipid bilayer of cell membrane, which in turn is made up of ergosterol and beta-1,3-glucan synthase. History of antifungal therapy. This image gives us the information that the development of the antifungal agents in the chronological order, that is from 1950 to 2020, that is starting with the NYSTATIN, AMPHOTERICIN-B, GRISEOFULVIN, to some of the recombinant interferon therapies, as well as the development of the newer compounds like VT1161, MOB015. Classification of antifungal agents. There are majorly 6 different classes of antifungal agents. First one is antibiotics. Second one, azoles, in that imidazoles and triazoles. Third one, fluorinated pyrimidines. Fourth one, chitin synthetase inhibitors. Fifth, peptides or proteins. Sixth, miscellaneous. Coming to the first class, antibiotics. Examples include amphotericin-B, GRISEOFULVIN, NYSTATIN. This is the structure for amphotericin-B. This is the structure for GRISEOFULVIN, and this is the structure for NYSTATIN. Now we will see the mechanism of action of amphotericin-B and NYSTATIN as antifungal agents. These two drugs, that is amphotericin-B and NYSTATIN, are polyene antibiotics. Here is the mechanism of action. These drugs bind to the sterol moiety, that is ergosterol. Due to the interaction with sterols of cell membrane, they form pores and channels. This in turn results in the increase in the permeability of cell membrane. Further, it results in the leakage of cellular constituents and ultimately cellular death. Now, the mechanism of action of GRISEOFULVIN as antifungal agent. GRISEOFULVIN interacts with polymerized microtubules, which results in the disruption of mitotic spindle. Thereby, it acts as a fungistatic drug. The next class is azoles. Based on the imidazoles and triazoles nucleus present in these drugs, they are further subdivided. Examples include miconazole, terconazole, ketoconazole, iconazole. Here is the structure of miconazole. This is the structure for terconazole. This is the structure for ketoconazole. And this is the structure for iconazole. Continuing with the azoles. Here few more examples. CLOTRIMAZOLE, very well known drug. FLUCONAZOLE, butaconazole, bifonazole. This is the structure for CLOTRIMAZOLE. This is the structure for fluconazole. This is the structure of butaconazole. And this is the structure of bifonazole. As you could see, in case of fluconazole, it is containing a triazole heterocyclic ring as the parent moiety. So, as well as you could see in case of butaconazole, bifonazole and clotrimazole, they are containing imidazole heterocyclic ring as the parent moiety. Continuation with the azoles. Few more examples include zinoconazole, itraconazole. This is the structure of zinoconazole. This is the structure for itraconazole. Now, the mechanism of action of azoles as antifungal agents. These drugs inhibit 14-alpha demethylase enzyme. Due to this, conversion of 14-alpha methylsterols into ergosterol is blocked. Further, accumulation of 14-alpha methylsterols in the cytoplasmic membrane disrupts the packing of aryl chains of phospholipids. This in turn disrupts the functioning of membrane-bound enzyme systems such as ATPase and electron transport system, leading to the inhibition of growth of the fungi. Next class is fluorinated pyrimidines. Example is FLUCYTOSINE, and this is the structure for FLUCYTOSINE. Mechanism of action of FLUCYTOSINE as antifungal agent. This drug, by the action of enzyme cytosine deaminase, gets converted to 5-fluorouracil. 5-fluorouracil further gets converted into 5-fluorodeoxyuridylic acid. This false nucleotide inhibits thymidylate synthetase. This further deprives the organism from an essential DNA component, thymidyllic acid. This finally results in the inhibition of protein synthesis. Next class, chitin synthetase inhibitors. Example, NIKOMYCIN. This is the structure of NIKOMYCIN. Mechanism of action of NIKOMYCIN. This drug competitively inhibits chitin synthetase enzyme as it is a structural analog of this enzyme substrate, that is uridine diphosphate N-acetyl glucosamine. Here is the structure for uridine diphosphate N-acetyl glucosamine. Next class, peptides or proteins. Examples include L-norvenyl FMIP, cis-pentacin. This is the structure for L-norvenyl FMIP. Its chemical name is E22-amino pentanamido 3,4-methoxy 4-oxo but 2-enamido propanoic acid. This is the structure for cis-pentacin. Its chemical name is 2-amino cyclopentane carboxylic acid. Next class is miscellaneous. Examples include NAFTIFINE, cyclopyrox. This is the structure for NAFTIFINE. Its chemical name is N-methyl N-naphthalene 1-eel methyl 3-phenyl prop 2-in-1-amine. And this is the structure for cyclopyrox. Its chemical name is 6-cyclohexyl 1-hydroxy 4-methyl pyridine 2-1-H-one. Here are the few more examples under miscellaneous class. TOLNAFTATE and terbinafine. This is the structure for TOLNAFTATE. Its chemical name is O-naphthalene 2-eel N-methyl M-toluene carbamothionate. This is the structure for terbinafine. Its chemical name is N6,6-trimethyl N-naphthalene 1-eel methyl hept 2-in-4-1-amine. Coming to the synthesis part. Here we will be seeing some of the important compounds synthesis. Amongst that, the first one is synthesis of GRISEOFULVIN. Here, the synthesis of GRISEOFULVIN involves 5 steps. In the first step, there occurs reaction between the two reactants, that is 2-chloro-3,5-dimethoxyphenol and 4-chlorocarbonyl 3-methoxy 5-methyl phenyl oxyacetate. In the presence of aluminum trichloride, they undergo the reaction to give rise to the compound that is 3-chloro-2-hydroxy 4,6-dimethoxyphenyl 3-chloro-4-hydroxy 6-methoxy 2-methylphenyl methanone. This compound on further treatment with potassium ferricyanide in a mild alkaline condition gives rise to the compound dihydrogriseofulvin. This compound further on treatment with rhodium or selenium dioxide undergoes selective reduction to give a racemic mixture of griseofulvin, that is DL-griseofulvin. This particular compound on further treatment with quinium methosalt, that is here the resolution process is applied. Due to this, there is a formation of a compound that is D-griseofulvic acid. Next, this compound on treatment with methendiamine gives rise to the final compound of our interest, that is D-griseofulvin. Next, synthesis of fluconazole. This synthesis involves basically 3 steps. In the first step, there occurs a reaction between 3-chloro-1,2,4-difluorophenyl propane 1-one and 1H1,2,4 triazole. There is a condensation type of reaction that occurs between these two starting materials. With the liberation of hydrochloric acid, there is a compound generated which on further treatment with sodium hydride and trimethyl silane results in the formation of 1,2,4-difluorophenyl 3,1H1,2,4 triazole 1-nil propane 1-one. This compound further on treatment with 1 more mole of 1H1,2,4 triazole results in the condensation type of the reaction, which results in the formation of fluconazole. Next, synthesis of clotrimazole. It is a one-step synthesis which involves the reaction between 1,2-chlorophenyl diphenyl methyl chloride and imidazole. There occurs a condensation type of the reaction between these two reactants to yield clotrimazole as the final product. Next, synthesis of FLUCYTOSINE. This synthesis involves the starting material 5-fluorouracil. This particular starting material, when it is treated with phosphorus pentasulfide, it results in the formation of a compound that is 5-fluoropyrimidine 2-one-4-thione. This compound on further treatment with thionyl chloride results in the formation of a compound which on further treatment with ammonia results in the formation of FLUCYTOSINE. This is the synthesis of NAFTIFINE. It is again a single step synthesis which involves the starting materials N-methyl 1-naphthyl methylamine and cinnamyl chloride. These two starting materials undergo reaction in presence of sodium carbonate to give rise to NAFTIFINE, which is a condensed product of these two compounds. That is, the starting materials undergo a condensation reaction to yield NAFTIFINE as the final product. This is the synthesis of TOLNAFTATE. Here, there occurs a reaction between 2-naphthol and chlorothionyl chloride, where there is a condensation type of reaction with the liberation of hydrochloric acid to give rise to the compound orthonaphthalene 6-eel chloromethane thioate. In the presence of N3-dimethyl benzene amine, this compound, that is orthonaphthalene 6-eel chloromethane thioate, gives rise to the final compound TOLNAFTATE. After studying this antifungal topic, some frequently asked questions need to be known. They are as follows. The first one, define antifungal agents, classify them with examples. Second one, give the synthesis of GRISEOFULVIN. Third, give the synthesis of FLUCYTOSINE. Fourth, give the mechanism of action of NYSTATIN. Fifth, write a note on azoles as antifungal agents. Sixth, give the synthesis of TOLNAFTATE and NAFTIFINE. Seventh, give the synthesis of FLUCONAZOLE and CLOTRIMAZOLE. Eighth, write the structure and use of itraconazole and saquinavir. Thank you.